everyone. My name is Kerul Patel and I'm living a near normal life with chronic myeloid leukemia, also known as CML, for the last 20 years. My diagnosis was by chance in September of 2003. Running high fever and suspecting the dengue virus, I was asked to do a blood test, which, besides confirming the dengue, also revealed I had very high white blood counts. I had to undergo a bone marrow biopsy, which confirmed I did have CML. And for clarity, there's no relationship between dengue and CML. The diagnosis was by chance. My doctor immediately put me on oral medication called Gleevec, dosage 400 mg. For some reason, my BCR-ABL results, which is a blood test that one does to determine the tumor load for CML, stayed well above what the doctors desired. And so within a year, my dosage was increased to maximum that you can give a patient, which is 800 mg. I went through a lot of side effects with that high dosage. The most troubling ones were nausea, vomiting, painful muscle cramps, weight gain up to almost 9 kilos due to water retention, low energy levels. I was always tired and sleepy most of the time, joint aches and pains, and headaches. Now, some of the side effects, such as nausea, vomiting, headaches, they were overcome within a year. I pretty much did not have to do anything at all. Eventually, the body starts getting used to the daily medication that you take. It's the muscle cramps that I had a lot of trouble with. And although the doctors did help by advising and prescribing to take magnesium and calcium supplements, it did reduce the cramps to some extent, but it would never go away. And that is something I live with even today. The high dosage meant that my immunity was compromised, and so for many years after diagnosis, I avoided crowded places just to avoid contracting communicable diseases. I undertook some lifestyle changes, such as reducing the spice intake in foods, getting extra rest in the afternoons by taking 15 to 20 minutes of power naps, increasing my water intake. I used to have almost 2 liters per day to stay hydrated, and then I started light exercises. It was in 2008, almost 5 years after diagnosis, I resumed karate, something that I was very passionate about since childhood. I trained for almost 10 years and I ended up clearing my third degree black belt before hanging up my belt in 2018. Goes to show that you can do all kinds of activities under CML if you can. Today, it's been almost 20 years since my diagnosis and I'm 52 years old. My CML is well under control. It's been a long journey with ups and downs, but isn't that what life's all about? I feel like I'm living a near normal life. All I have to do is take my daily medication, visit my doctor as advised, and do the necessary blood tests to keep tab on my CML. My message to all listeners is that first things first, compliance, very important. Meaning, please take your medication regularly as prescribed by your doctor. Second, cultivate some sort of a healthy lifestyle habits such as good diet, light exercise as per your capacity. It will only help you fight CML better. Last but not the least, it might be a little generic, but do what you can in your capacity to keep stress at bay. A good mental health is as much of a booster along with medication, diet, and exercise in fighting CML. Stay happy. And I quote, a day without laughing is a day wasted. So, thank you for listening. Good luck and my all the very best to you all.